Hello and welcome to the program. I am Mary Kanu. Nigeria's healthcare systems have been negatively affected, both directly and indirectly, influenced by the shortage of available medical doctors. Medical brain drain also exacerbates the shortage of medical doctors, indirectly causes adverse effects on all health outcomes, especially maternal and child health in rural and low-resource communities. The picture gets even grimmer after the president of the Medical and Dental Consultants Association of Nigeria, MD Khan Aminu Mohammed, said that it would take Nigeria 10 years to replace the 500 doctors who recently left the country in search of greener pastures. Mohammed said this against the backdrop of findings by the association confirming the exit of medical personnel from the shores of the country. He, however, disclosed that if there was no improvement in the current condition in terms of emoluments, working condition and security, it would be very difficult to prevent people from migrating out of the country. Well, to speak on this worrisome trend and the report from the Medical and Dental Consultants Association of Nigeria is ophthalmologist Dr. Ubong Akang. Thank you so much for joining me
Okay.
on the program. We know that the brain drain in Nigeria's medical sector has created a great challenge, for public health systems. So what are your thoughts on the reality that it will take Nigeria 10 years to replace 500 doctors who have, relocated in search of greener pastures?
Okay. Thank you. That's a nice question. In the first place, I think it would be better to just say one or two things about brain drain. It's just a word that has been coined to define the movement of health personnel in search of a better standard of living and life quality, and perhaps higher salaries, to also have access to advanced technology, and then to have a more stable political condition and security in different places, worldwide. So that's just the whole idea. But as returning to your question, I would like to say that it is really true. It's a great challenge, especially if the government will not close the gaps and the leakages, in the health, system, as in maybe training more doctors will be like, pouring water into a basket. They just need to make sure that they get their acts, together, because as we train, more will keep on living. More will keep on living in the country because the economic outlook is too frightening, especially for the young, doctors, who have bright, prospects. They cannot see themselves surviving in a harsh economic environment as it is today, coupled with insecurity of lives, which means he can't even run around to work at different, places just to make ends meet, without being constantly on the watch out, security-wise. It is quite, frustrating for the young persons, So except our economy improves, it portends a bad outlook. If senior doctors even find themselves, having difficulties in maintaining even their cars, it means that he has been pushed out of the middle class into the low-income group. That's what it means, even for medical doctors, when his colleagues turned outside that they were doing things together, whose economy are still stable. By the time he compares himself, he thinks that desire to just take off is just there. The society and relations and family members, they have high expectations. A doctor, you call a medical doctor, people expect that you should treat them for free. Relations come and you give them drugs. If there's no money, it's an embarrassment. So the doctors just know that they just have to do something. Anyway, let's not just, maybe, we can still say that a lot more after that. Just about 7 years ago, a doctor who may have earned an equivalent of $6,000, right now it is less than $1,000 that such doctors are earning, and the salaries are not increased, and there's galloping inflation, unchecked, free fall of the economy. So these are all the issues. Maybe I'll just stop at that for now.
All right, the migration of health professionals from Nigeria deserves critical attention. You may agree, due to its adverse effects on the healthcare system. Please give us like a picture of how bad the situation is at the moment.
Well, as it is, we train maybe like an average of 3,000 doctors annually. And we have like about 25,000 doctors officially on ground in quote, and we need like 365,000. So that means that what we have on ground is less than 10% of what WHO, population-wise expects Nigeria to have. Meanwhile, we have like 20,000 health, professionals, mostly doctors outside the country, almost half are outside the country, and academicians also, like about 10,000 of them, are outside the country, and many more. In an interview conducted in May 2023, 52% of health workers, they say that if they have the chance, they will leave. That means that with this 25% that we're having now, 12,000 are ready to leave if they get any work outside the country. You know what that means? That means that there will be adverse effects, loss of skilled workers, loss of potential future entrepreneurs, loss of confidence in the economy. That's what it means. If a medical doctor, that can go outside and work for 6 months, and that 6 months salary can cover his pension of what he has worked for 35 years, just 6 months. And the government had the opportunity to have done one or two things to stop this kind of thing. Anyway, maybe we can still say some more things later on. I'll just leave it that. So it's a very bad situation. Just 3,000 doctors annually. Even for them to go for housemanship, they have to queue. Even these ones, they have to queue to go for housemanship, and then go for youth service. And then the government, instead of looking into this, they are trying to make laws that these people should stay 5 years. These are people that were trained by their parents. Many of them did not have scholarship from this government, and parents have expectations. And after spending so much, maybe these ones can also help them. It's a bad situation.
Although we have a new administration, the Tinubu-led government, but how would you rate, the past administration as regards handling burning issues in the nation's health sector?
Well, to me personally, I think they fared poorly, in my opinion, my own rating. They had the opportunity to have, like, one of the ministers during the COVID period, they had said that they will increase the retirement age of doctors who retire at 60. Somebody at 60, as a medical doctor, you are still very much active. You have professors that retire at 70 because, okay, in the academic section, professors can stay till 70, but out there in the other sectors where doctors are working, they only retire at 60. So the doctor spends money, trains, and just at 60, you retire him. I had to spend in 2008, 2000, I had to spend my hard-earned money to go to India. They used to train doctors, to go out for subspecialties, maybe in the 80s. But all of that stopped. I had to use my own money, go train myself to subspecialize in oculoplasty. And I came back and I've been working using that to work free for the government. So if I have a chance to go for maybe 1 or 2 years out there to go and make the money that I would have, that even my pension, the money I will make in 2 years, my pension will be like maybe 25% of that kind of money. So you can see the government is not doing well. If they had increased, maybe the retirement age of doctors even if it's from 60 to 65, that 5 years could make a lot of difference. But a lot of them would say, okay, these 5 years, I can still make something, that will help in the next few years after, retirement. That can keep many of them back. But if after working for 35 years, and the inflation has eroded whatever gains, your pension would have, given you. Some of them will just want to quickly go out and make some money. So these are all the issues, Infrastructures are not, medical facilities. Now there's poor electricity. Our CT scan machines, MRI scan machines that are so sensitive, many of them are packed up. The ones that we have in the city where I am now, about 4 or 5 places where people could go for CT scans. The machines are packed up because, the electricity is not stable, And these are machines that maybe they will use like 900 million, 1 billion to buy such machines. And if anything spoils, you will need like 200 million to repair it. So those things are there. And you need these machines to diagnose, tumors. I work in the area where you need to diagnose tumors and so on and so forth. You want to do surgery, you need to see where a particular tumor is in the brain so that you know what approach you use. That will make life difficult. Why would a doctor stay here and be passing through such difficulties, when the government could fix light? Light is being fixed in other countries. Why is it not being fixed in Nigeria? Why is Ghana having light 24 hours and we don't have light in Nigeria? Are they in the moon while we are somewhere else? It's a problem with the government. They need to do something about common light so that our equipment will not be breaking down. People will stay back. And doctors need a stable environment to be able to do research, because we are research oriented. When there's insecurity, how can somebody think well with so much insecurity? Some time ago, doctors and nurses were being picked up here and there, such insecurity. So when people go out, they look at the security, what will make them to have an environment to do critical thinking, do research and all of that, which is where the world is going to now. You research and come up with new ways of doing things, So the government there's still a lot that the government can do to ameliorate the situation. So that's what I can just say about that.
Now, with the new administration comes the new Minister of Health in the person of Ali Pate, and he has said he will work to improve the country's health sector. So what are some reforms you expect him to implement?
Well, we'll just say congratulations to the new Minister of Health, and we wish him well. We hope that he will be given the right environment to do whatever health reforms he deems fit, for the country. But we expect fresh incentives to entice those who are just about to leave, so that at least they can stay behind. If we can just say, okay, increase in the retirement age of doctors and other health workers, that is one area that can at least settle some of them, because if one feels that he has 1 or 2 years to retire and he looks around, he has nothing to show for it. The next thing is that, he has already thinking of where else to go and make extra money. So that's one thing. We know that even our justices, in the courts, they stay till they're 70 years old and all of that. So why should doctors retire at the age of 60 when they're still very much active? So, and there should be more infrastructure, like I said, medical equipment we need it to work with, and there should be stable light. There should even be solar farms. When I traveled out to one West African country, in a hospital that I went to, they had a very large solar farm. Even if there's no electricity from that farm alone, it powers the whole place. So why is we have enough sunlight over the atmosphere of Nigeria? Why are solar farms not working? Why is everything not working in Nigeria? Why is it working even in the Gambia? That is what we should be thinking about. Human resource development, training and retraining of doctors and other staff. I had, as far back as 2008, I had to use my own money. Meanwhile, there are still some sectors that are still sending, other, professionals out to be trained outside. Why are doctors not being sent out? There should be a conducive practice environment. Then budgetary allocation. It was just this last budget of 2023 that Nigeria was able to budget 1.17 trillion. It has never been like that. There's always been poor budgeting for the health sector, but let's hope that the minister will be, given the appropriate support, and money will be released. for these monies to be sent to the appropriate areas to make things work. That's just a little bit I will have to say concerning this,
All right, well, we can only hope that the reforms, as you have said, are implemented. Well, ophthalmologist Dr. Ubog Akang, thank you so much for your time. All right, let's take a short break. The program will be back shortly. Stay with us. Welcome back to the program. We're still talking health. This time it is a report by the World Health Organization revealing that malaria death rates in Nigeria dropped by 55% between the years 2000 and 2021. The WHO Regional Director for Africa, Matshidiso Moeti, who made this known during the launch of the 2022 Nigerian malaria report in Abuja, said incidents recorded from malaria also dropped by 26% within the same period. Moeti said although Nigeria accounted for about 27% of the global burden of malaria cases, the country has made significant progress. Well, despite this good news for Nigeria, Moeti said that Africa carries a high proportion of the global malaria burden, accounting for about 95% of all malaria cases and 96% of all malaria deaths in 2021. How then can Nigeria be malaria-free? To discuss this further, I'm now joined by the chairman, International Institute of Advanced Research and Training, Chidikon Medical Center, Owerri, Dr. Philip Njamanze. Thank you so much for joining me on the program. We all know malaria is a very severe public health issue in Nigeria with, even higher morbidity and mortality rates than any other country. So does this report by the WHO match the country's current reality?
Yes. Well, that report is a welcome news that there is a downward trend in the incidence and mortality. However, the reality is in 2001 and 2021, there were 68 million cases of malaria and 194,000 deaths. This is very, very high, even if you consider that there was a drop of 55%. So really, there is nothing to celebrate in the real sense of it, because it is unacceptably very high. And this reflects the very poor health system design in Nigeria. Every health system must have three component parts. One, the treatment arm, where you go to hospital and receive treatment. The next is the preventive arm, that actually tries to prevent diseases, monitor diseases, and go to the localities to take measures to prevent disease. That's the preventive arm, controlled by an organization like the NCDC. And the third arm is the research arm. So it's a tripod that holds a health system. Nigeria, for years, until the recent pandemic, had only one arm, the treatment arm. And that is not sufficient, because the main driver of the health system is actually the research. And we should have the National Institutes of Health at the federal level, at the state level, and also the local level, at the local government level. So, and then we should have the same thing, a Surgeon General who heads disease prevention programs at the federal level, at the state level, at the local government level, and even at the world level. This is the proper design of a health system. So what we have in Nigeria is not a health system. It's just fragmented healthcare where government provides some care and some private institutions provide care. It is not a coordinated health system.
Do you think the government is putting in enough effort, to see that the country wins the battle against malaria as the WHO has suggested?
Well, I think you have to put your money where your mouth is. It's welcome that about 1.17 trillion was voted for malaria in 2000 in the budget of 2023. But this is a paltry sum because the total budget was 20.8 trillion. So it's about 1/20th of the amount of money that is required. So it's just too little, and we should have a health system that has at least 5% budgetary allocation. And this budgetary allocation of 5% should actually be divided to the three arms of the health system. So we have enough money going for prevention, which will do a lot to reduce the cases of malaria. Today, even the colonial times when we had sanitary inspectors to clean the gutters and provide insecticide in locations, these things are no more obtainable at the local level, at the state level. So you see a complete absence of governance in health in this country as it is today. And this needs to be addressed because the most important aspect of governance is the health of the nation. If the people are not healthy, then you are governing either sick people or dead people. So I think that's number one responsibility of government, to provide adequate health care. And I think so far we are not doing so well, even when you consider such reports like what the WHO just issued. And I hope that Nigerians will just take it with a pinch of salt, because it is just too little to reflect the health burden we have. So I think the government should buckle up and do the needful and provide adequate health care. And through a well-designed system. This system is deficient, and there's nothing you can achieve with it the way it is designed right now.
All right, well, Nigeria was excluded, from the list of 12 African countries to receive the malaria vaccine Mosquirix, developed by global biopharma company GSK. Is this a wake-up call for the country, to develop vaccines of its own, or do you think, Nigeria even has the capacity to produce vaccines?
Well, quite frankly, vaccines for malaria or vaccines for other diseases should be something that one can use for a limited control. The truth of the matter is vaccine is not a panacea for everything, even in medicine. So it has to be targeted. For example, for the under fives in particular areas, and this could be useful. And it is national security when it comes to vaccines, above everything. So we really cannot be entrusting provision of vaccines to some international organizations or foundations. This is national security, because anybody that has access to the people to vaccinate them could do anything. You can just decide to wipe out the whole country if they want to. So we should not, and I think the correct thing, we should not be accepting vaccines from anybody, no matter whether international or private. If they want to help with the public health issue, they should contribute financially for us to make the vaccine ourselves and administer it ourselves. So that is the correct thing to do. Nobody entrusts, no serious country entrusts vaccination of their people to any international organization or foundation or any other person. This is national security, and the thing that we have been doing in this country is very wrong, and is counter the interest of the country. We must not, be it for COVID, for malaria, or any other thing, we must only administer vaccines which we have produced or have been produced directly under our own supervision. This is what is called national interest. Vaccine is a national security issue.
Well, let's talk about Africa generally. What then would you say can be done, to ensure eradication of malaria on the continent?
Yes, we have advocated a very simple way to eradicate malaria. All the fall in incidence was achieved by artemisinin-based therapy. That is artemisinin combination therapy for malaria. And all what we are saying is that the same drugs that are being administered for vaccine should be administered at the same time, 4 times a year, at the same date, at the same time to everybody living in the Federal Republic of Nigeria or elsewhere, even across Africa. So we have 4 malaria days and everybody takes the drug at the same time. What will that do? What it will do, it will wipe away the parasite in blood. When it wipes away the parasite, it's a vector-borne disease. So the vector comes to bite you, and when it bites you, it transmits that to the next person. But when it comes to bite you, it will bite you and you do not have the parasite in blood. So there is nothing to transmit. We can, within 2 years, break the transmission, this transmission of malaria. This is the only way I see going forward that we can break the transmission of malaria across the continent. So have 4 malaria days spaced at 3 months interval, and everybody living across Africa will take the anti-malarial drug that they usually take and get well. The same drug, but they will take it 4 times a year. And we will break the transmission, and we will still have some malaria cases because the vector might be harboring the parasite. But we know that they have 120 days and it will expire in the system. So gradually, if we do it repeatedly, we will now wipe away even the vector, the parasite in the vector. This is a very simple thing to do. We still do not understand why the different countries have not adopted. This is published data in literature already. And we think that that's the very serious way to go. It will be far more effective than the use of vaccination, and it will protect all layers of people, right from children to adults.
All right, Chairman, International Institute of Advanced Research and Training, Chidikon Medical Center, Owerri, Dr. Philip Njamanze, many thanks for your time and your contribution.
Thank you for having me.
All right, well, that's our program for today. Thank you so much for watching. I am Mary Kanu. Bye for now.